You need clinical laboratory information to be integrated into that record. So quite often in an oncology delivery, the patient is going to have their labs drawn on a very repetitive basis, and that the lab results will determine whether the patient is going to progress to treatment that day or the very next day. So again, you need to have real-time access to the results of your clinical laboratory. As I said before, reporting has been a long-time requirement in the oncology workspace, and so there's well-established registries in the UK. But for many years, it's been a manual process of extracting data from the clinical chart, the diagnostic information, the outcome information, the treatment information, and reporting it up to the regional and national registries. And so our vision is that also it would be a better environment if you had one comprehensive set of applications that could communicate this information and the outcome information to the registry. And finally, practice management. So as I alluded to, it's all well and good to have an electronic medical record, but if you're working in isolation of the practice management tools in the hospital, you could find yourself prescribing and recommending the finest treatment, but if you don't have chairs and time on the linear accelerator that's available, it doesn't do you very good. So why don't you have an environment that integrates both the practice management elements of caring for your patient along with the medical information? Now, we're fully aware that in most environments, we are not working in isolation, so that we're working in the environment of a trust, a hospital, or a cancer network, and that we do need to be able to communicate with other applications and systems in a hospital record. And so for the most part, like many information management systems in oncology, we try to exchange information with the greater trust information management systems through standards. It is very difficult from a manufacturer's standpoint to imagine interfacing any other way, because every hospital or country or region may have a different standard of their way of exchanging information systems. So for a specialized information management system, the only way to go is really by the use of standards. So we do rely very much on HL7 and DICOM as our methods of communication with the outside world. But we feel that you need to integrate not only the medical care for the patient, but also the practice management care for the patient. And then we also feel that one of the detractors from clinicians to actually engaging with an information management system is they're not really getting a whole lot out of these systems. We haven't been very good at giving clinicians meaningful information that would incentivize them to actually get their hands dirty in using the system. And so we do also feel that you need to give tools to easily aggregate the information so that clinicians and cancer networks can then start benchmarking and easily visualize the data that they have and how they compare to their cohorts in the region or in the country. So again, giving tools to visualize, aggregate, and report is an important responsibility of an information management system. So if I look at in the oncology workplace, given that what we feel is an oncology information management system, how can we improve patient care? We can improve patient care for the clinician and the clinical oncologist by giving them the relevant information in one screen, in the context that they need when they're making the decision whether they're going to treat or not, whether they're going to dose adjust or not, whether they're going to hold the treatment or not. So you need to give them a workspace that makes sense to them, that aggregates the information that's important to them. So for example, you can give them a template. So in terms of standardizing care, we want to give them a template where they're always working in the same environment. And you want to give them the information that's relevant to them. So when I'm prescribing chemotherapy, I want to know whether there's a radiotherapy course of treatment and what that is. I want to know what the lab results are and how the patient's reacted. I want to know how what the patient assessment was, whether the patient is neutropenic or not, whether the patient was faint after the course. So I also will need to see not only today's events, but I need to see how the patient reacted to the previous courses of treatment. And I also want to communicate to the rest of the team what I plan for the patient in the future. It's not a single transaction, your chemotherapy. It's a cyclical and a long-term course of treatment. We also want to give the clinicians rules and, pardon me, I'm losing difficult finding the word, rules-based engines to give them some alerts and mechanisms to prescribe accurately. So interacting with the compendiums and the formularies for the drugs so that the clinician is alerted at the time of prescribing that they're about to prescribe something that is perhaps contraindicated based on other medications that the patient is taking. So those are areas where we feel that in terms of patient care, if we're giving the clinician a total view of what's going on with the patient care should be improved. We actually do have other people from the University in Coventry here in the audience, and I didn't know that when I put the slide together, but your colleagues from the Cancer Centre, the Arden Cancer Centre in Coventry, were one of the first people in the UK that we're aware of that implemented a comprehensive oncology information management system. And Dr. Irwin had commented on the use of a system that gives him the information that he needs at his fingertips when he's about to prescribe and select the treatment for the patient. As I said, we also think that an oncology information management system needs to look at the patient in a holistic manner. So you have radiotherapy, chemotherapy, and surgery, but these patients are also managed by a number of supportive care professionals, and you need to give those professionals access to the patient information. So for example, dietary, nutrition, social workers, and the palliative care teams need to be plugged into that same information because they are going to be advising the patients on their care, and they need to have real-time access to the patient's information. And as I said, we also need to be supporting information from laboratory demographic scheduling systems. So again, one of our users comments on just looking at the patient in a holistic manner. In the world of paper and film, we were very used to carting around 3 different charts for that one oncology patient. And why would we do that when we have the ability to consolidate all that information in one place for the professional? The other thing that people are hoping that an information management system will do is drive trust towards best practices. It's in oncology, we have lots of evidence from clinical trials and lots of standardized oncology protocols, but very seldom do we actually find practices that are actually adhering to them. You'll go to one practice and 7 oncologists will have very different interpretations of the FEC protocol, which is very, very common, but they all have a different take on it. From patient care, standardization, wouldn't it be nice if we can actually drive your oncology practice to really adhering to some standards? Not only does it improve the patient care and patient safety, but as we will see later on, it also helps the pharmacy stock the appropriate drugs in their formulary. So from an efficiency standpoint, driving a group towards standards is very important. So an application not only should offer you an ability to have a library of standard protocols for oncology, it also should give you the ability to drive standards in the way you assess and document the treatments that you're delivering. Because only when you do that in a templated, standardized way can you actually extract information easily and in a meaningful manner. So from a patient care, we also talk about efficiencies. As I said, most information management systems, you're seeking to provide to the clinicians and to the users the right information at the right time. And oncology is no different.